Our top story, Delhi is witnessing a surge in COVID cases and the capital once again reported over 2,000 COVID cases in a day. The number today is around 2,300 new cases in the last 24 hours. One person succumbed to the virus over the past 24 hours. In fact, this is the fourth day in a row that the national capital has recorded over 2,000 COVID cases. The positivity rate in the last 24 hours was at 13.84%. Delhi currently has 7,349 active COVID cases. In fact, meanwhile, in the country, over 18,000 new COVID cases have in fact been reported. And it's not just Delhi, but it's also Mumbai, which has seen a COVID spike, though the numbers are nowhere close to the kind of numbers that we're seeing in Delhi. But what seems to be the concern is that there's been a dip in testing. Now, the centre has flagged rising COVID cases in the state and a drop in testing in 20 districts. This comes at a time when Mumbai has in fact seen a doubling of cases. In fact, 486 COVID cases were reported in the city over the last 24 hours, while last week the tally was around 286. Other districts like Pune, Sangli and Nagpur are also witnessing a spike in weekly COVID cases. And joining me on the show to discuss further on this is Dr. D.K. Gupta, who's the CMD of Felix Hospital. Dr. Gupta, thank you so much for sparing time for this very important discussion. In fact, here on Mirror Now, we've been focusing on COVID spike over the past couple of days, specifically in the national capital. While we have entered a situation where wearing of masks has in fact become a mandatory step of sorts. A lot of people are probably not resorting to it. Some people are of the mentality that maybe now we need to start looking at it like a common cold. But what we can in fact see is that there's been a spike in cases in the big cities. The numbers may vary between Delhi and Mumbai, but this is along with the fact that the use or the administration of booster doses has not in fact been in tandem with the way the health ministry or the state as well as the centre would have wanted it to go ahead. So keeping that in mind, is there a cause of concern?
Definitely, you're absolutely correct. We know that more than 18,000 cases had been reported yesterday in India, and more than around 40 deaths had been reported also. And we talk about Delhi, there are around 1,900 cases reported. And these are reported, RT-PCR reports are mostly uploaded on system. There are few antigen testing are going on the community and they are not reported. It means cases may be high, number can be high, it is under reporting is there. And we all know that in different studies it has been proved that a COVID vaccine immunity begins off after 6 months, average 6 months. Even in few cases it has been seen that after 3 months COVID antibodies begins off. Therefore, ideally, the booster dose should be given in the 6-month interval, but currently we are giving it a 9-month interval. It means those who have been vaccinated around 6 months back, most of those population are vulnerable. They are prone to get infected. They are prone to get disease. They can have complication, even death also. It means I think government needs to revise this policy so that vaccination can be given at 6-month interval for the booster shots. And I think booster doses are not too many. The data is here that we know that booster dose, the people's response for a booster dose is not quite good. Therefore, I think we should all motivate people to get booster shots as early as possible, at least those who are eligible. Second, we should revise the policy for booster dose. Third thing, there are children from 5 years to 12 years, vaccine have been approved for these class, but vaccine has not been rolled out. They can act as not a source but reservoir of infection, carrier of infection. They can be infected, they can have disease, even we have seen serious children, or they can transmit disease if they are asymptomatic or mild symptomatic to the adult person, those who are residing with them in the family. It means there are significant population of India that is unimmunized, they are unvaccinated, they are at high risk, they are vulnerable and they can get disease and they can get infection. So I think two major points we should consider at the government level. One is that revision of the booster dose interval from 9 months to 6 months, and second, rolling out vaccine for 5 to 12 years as early as possible. Third, we all know that COVID is here and it is not going too early that we were thinking. Therefore, I think we all should follow the COVID appropriate behavior till it becomes endemic. And not COVID, it will prevent from other disease like this monkeypox also. So therefore, hand hygiene, respiratory hygiene, they are all needed for all population, not for monkeypox, COVID, other droplet infection, influenza, cold, cough, tuberculosis, and even
Right.
other. Yeah.
Doctor, also just wanted to ask, I mean, do you think that the state and the central governments, there could be a strategy which is different for Delhi or different for Mumbai, but should there be a situation where we are looking at bringing a little more precautionary measures, whether the government does it or whether as a society people decide to do it themselves, because we can see a certain spike clearly in Delhi, and even in Mumbai we can see on a weekly basis, if we look at Mumbai and Pune and a couple of other districts in Maharashtra, there's been clearly a spike in cases. So in terms of precautionary measures, the level of precautions that we're taking at this point, does there need to be a more conscientious approach that we need to take as a society over this, even if the government does not mandate anything?
Definitely, we all know there are guidelines, there is policy, and it has been implemented in past also. If the positivity rate is more than 5%, what to do between 5 to 8 and more than 10%. And in different districts, depending on the positivity rate, case load, and we decide what measures to curtail the infection should be taken. And government has policy. I think this policy is already implemented. I think their awareness is lacking among general population, because we know that COVID is not looking like it is not serious, but it can be serious at any time. Whenever there will be any mutation that is lethal to us, that can cause serious side effects, serious complications to general well-being. Definitely, I think public should be aware that COVID appropriate behavior across the India, because it is endemic. Positivity rate is around 5% across the India, more than that, because the testing is low in the rural areas, even the tier 2 and tier 3 cities, even in tier 1 cities, antigen report testing is not reported as it should be reported. I think we should take precaution at least for next 6 months, 1 year, till it becomes endemic, till we have a good control over this. And one thing more I would like to tell, uh, we have to, even the governments of bigger countries, they should know that it cannot be contained, COVID cannot be controlled in their countries or their cities or their states. It has to be have global control, and there are maximum number of countries in globe didn't have vaccine, or they have vaccine very less in number, and their population is still vulnerable. The replication is going on in these countries, and whenever there is a replication or transmission, there is a chances of mutation. New mutants can come, and it can spread across the globe, and it can have a lethal effect like Delta. I think we should talk about the global control also.
Right, Dr. Gupta, very valid points. And thank you so much for joining us on the show with regard to the COVID surge that we have in fact seen, especially in Delhi. And also we can see there's a certain pattern which is developing in certain districts of Maharashtra. And even the center has said that the testing figures need to be higher than what they are in specific districts of the state. So definitely more needs to be done in terms of our own proactivity in keeping ourselves safe, even if there are no mandatory measures being suggested by the government. Shifting